We will now begin another discussion panel on health, and we will be addressing the challenges post-pandemic. We are talking about challenges that the whole country will have to face up in its different areas, and we're talking specifically about the challenges of the NHS. To speak about these matters, I have with me Raquel Duarte, who is a teacher at the Medical University and a doctor at Gaia Hospital, Mr. Rodrigues from the Regional Administration, Health Administration Center, and Teresa Guimarães, director and a hospital director and a teacher at the National School of Health. We will begin with you. We talk about the challenges of the pandemic, and in fact, the pandemic has required an added effort by the NHS to respond. We've become more aware of the NHS. Have we become more aware of the NHS? The NHS has always been around. The response that we've given was always evident for everyone. The issue is that it has been organized in a different way to respond to a pandemic. And this whole digital area, telehealth, remote health, has helped us to reach the citizens that couldn't go to the hospitals during this time. I think here we showed what the NHS is, an entity that is always by the citizen's side at any given time. This was obviously reinforced by the pandemic. João Rodrigues, do you agree that there was a need to strengthen the response capacity by NHS? Yes. Luckily in Portugal, the NHS has existed for 3 decades now, and this pandemic has showed us this. It exists, it has the conditions to be adapted, to be revitalized, and what seems to me to be essential with this pandemic, essentially the population and a few elites. The identity of the NHS was in fact reinforced, but we also had the other side. And it seems to me that we are at a very important stage, because there's an opportunity to look at what isn't working, the gaps that we have. There are many. Some of them have been around for quite a few years, and they will need to be bridged in the coming years. Namely, from my perspective, and this was evident, we reinforce the identity of the NHS. It is a network of healthcare units. It needs to be interconnected and interdependent, but we also show that on the other side that there's a weakness in that network in regard to this interdependence. And we saw that when managing beds in intensive care units. We saw that in managing the response of outpatient response to the community, namely the less serious COVID situations. We saw the capacity to work with the various hospitals, how they worked among themselves, the various healthcare centers, but they were still lacking a few things. And this means that if we want to be ready to daily, with or without the pandemic, because the issue isn't just the pandemic, the NHS needs to operate in a network. It needs to have synergy that creates a suitable response for the population. And I am persuaded that the pandemic will also serve to reinforce this identity. Raquel Duarte, I will now pass the floor to you. Do you feel that we have become more aware of the importance of the NHS? Some weaknesses or vulnerabilities may have been heightened, and perhaps we have become more aware of what happens in the future. Is that so? This year was fundamental. On the one hand, to see if the NHS works and to see that it does, and also to acknowledge its vulnerabilities and figure out how to solve them. When dealing with a patient who had COVID-19, we increased the capacity in hospitals and facilities. And this meant that we were able to respond to this added demand. there are various services in the network, and they did it, but we did have a lack of human resources. That was evident. Despite the increase in the number of healthcare professionals over the last decade, we still have gaps that we need to bridge. This isn't just in Portugal. The number of nurses in Portugal is below the European average. We need more nurses. The last OECD report estimates that even the doctors are below the EU average. The OECD data shows that it's undervalued here, and this lack of human resources was evident during the pandemic, which put the health services under pressure. I believe that in addition to enhancing the NHS, which was strong in responding, this showed the need or reinforced the need to have more healthcare professionals. They were overworked. The psychological pressure may have some long-term effects. In fact, there are studies that have shown that there's been an increase in stress and anxiety, insomnia, particularly those who worked in the COVID areas and the COVID wards. So what a final message that we figured out is that we need to work very well and take care of our healthcare professionals. The system works. We have the capacity. We need to take good care of it. Teresa Magalhães, key parts here in this pandemic, the healthcare professionals. What were the major challenges and what lessons can you draw for the future in terms of what you had to deal with at times of pandemic? First of all, the way in which they were reorganized to respond to such a challenge internally as a service, and how they had to organize themselves to be able to respond to all the patients who didn't have COVID, so non-COVID patients, who couldn't make their way to hospital. We witnessed a paradigm shift in the way that we offer healthcare. We began to introduce technology. It was already used, but it started to become much more used in a more comprehensive manner. We're talking about remote medicine, remote monitoring, which meant that healthcare went closer to the patient. So there was a proximity between the doctor and the patient. In terms of an occupational challenge for the healthcare professionals and the patients, who had to adapt to a new tool to be able to do this. This gave us a new way of offering healthcare. I'm sure that this is an innovation that will continue in the future. This isn't the end of it. João Rodrigues, in terms of technology and technology as an ally, what strategies should now be defined, namely in the digital area, to fight the challenges post-pandemic? This is a noble area that was reinforced by the pandemic. I've said it in many places that we talk a lot about technology, but the pandemic also showed us that a simple phone should be one of the most important tools to be used in quality when communicating with our patients and citizens. The pandemic showed us that we'd invested in technological networks with quite high engagement levels, but we'd forgotten about investing in a phone network with intelligent switchboards so that the citizen would easily access us and speak to the healthcare professionals. And I think that is the main challenge. The pandemic showed us that we have useless bureaucracies where the citizen doesn't need to make his or her way to the healthcare unit. We need conditions in the phone where a phone is accessible for healthcare professionals. The major corporations in services have loads of non-conformities when it comes to picking up a phone. Call any company and you will be on hold for at least 10, 15, 20 minutes. In health, there is organized accessibility, and one of the means is a phone. But we can't just stick to the phone. Everything else we have. This is a noble issue, an important issue. We have been evolving over the last few years, but we are still far from reaching the levels we desired. And the pandemic showed us that we are making a mistake again. For COVID patients, we have a platform called Trace COVID. So we created a platform outside of the citizens' clinical area. The country needs to be organized. We need to have a citizen-focused medical record. We speak about this language and we forget what people say. This means that there is only one medical record for the citizen and it can be updated. I'll give you a few examples. Let's imagine allergies. Now we're talking about vaccines. All of us as citizens need to have a background in terms of allergies. If I had one single medical record, then any doctor who can go into the record will show my allergies. And I will update it on that day, or I will read it and it's complete or not. What happens today? Every doctor writes down the allergy that the patient has. So every time I move from one appointment to the other, once again, I will be talking about my allergies. And obviously there are mistakes that I'll make and the story will be different. I could be talking about any area. The gain that we had with the pandemic, and the pandemic showed us, is that first we need a reliable database on our citizens, the ones who are entitled to the NHS, everyone. So that database should be reliable, where you have a mobile phone associated with it. When dealing with vaccines, we do not have updated mobile phones. So when we want to communicate with patients, we don't do that. We need a new national patient register. It needs to be robust. It needs to be reliable, so we can have one single medical record that belongs to that citizen, regardless of the healthcare unit, the hospital, continued care, the emergency or A&E service. It needs to be regardless of the healthcare unit. And if we can have this, if we can have investment for this, for the recovery and resilience plan, then we hope that the economy will foster this. We can't have different apps. We have 22 different apps and they don't speak among each other. So we need to centralize the information. No, not the structure, the citizen. It needs to be citizen focused. This is one of the first steps and one of the challenges. It will take years. Raquel, Duarte, what do you feel are the major challenges post-pandemic, and what can we do to learn from the lessons of the pandemic? The pandemic led to a strategy that was already taking its first steps. So we had this pandemic with a series of innovative and digital techniques for diagnosis, monitoring some chronic diseases and pathologies, and even in organizing the services, as Dr. Teresa Magalhães can confirm. It was very useful during the pandemic because of the safety and security measures that we had. Telemedicine, remote monitoring was very important because the patients could have their consultations safely. patients going to the healthcare units was overcome because they could reach their general practitioner remotely. But we still need to continue developing strategies, preferably from the perspective both user and provider. It needs to be adjusted to both of them and in conformity with the convenience of both of them, effectively and safely. And this will be very important. I think that this is what we need to invest in the next few years. The barriers to access, as Mr. João Rodrigues said, it was excellent. We need to make it easy to schedule a consultation. We need to find it easy to speak to our general practitioner. And the pandemic made it easier for that contact to happen. And we need to keep this in place, whether it's by phone, by email, or other technologies, other platforms, according to the convenience and the patient's capacity. Any strategy needs to be adapted to the provider and the user also. It needs to be accessible for all. I think that is our next strategy, our next challenge, yes, making it easier, more accessible for everyone. Teresa Magalhães, what are the main challenges and what strategies need to be defined for this future? Sandra, let me just go back on a few issues that Dr. João raised, which are quite pertinent and follow on from the future strategies. Focusing on digital, at this moment, we have a lot of information systems. We have a lot of information that has been computerized. And as Dr. João said, we need to start connecting it. He spoke about a centralized and single medical record. I am talking about a strategy to connect all of this information, making all the systems, this interoperability, have it work. Having interoperability standards and strategies that work, and have transparent information for healthcare professionals, for managers, and for the citizens, for the patients, so that they can have one single access to their information and they can be the holders of their information. This is what we hope to have in the future. With this pandemic, we saw that patients want to have access to more agile healthcare, and through the new technologies, being able to reach out to their doctor, reach out to healthcare professionals in a different way. Today, technology is moving in this direction, and at this moment, we are at a stage where it's possible to have patients being monitored at home, having citizens who handle their health in a different way, and they can be connected to their institution in a coherent way, meaning that they are monitored in a different way. That is the future, and citizens already demand this. This is the future. Working in the interoperability of these information systems, working on digital governance of these systems, working with information systems that yield the outcomes healthcare professionals need, electronic medical records that are much easier to use. And we also need to have a different type of leadership in this area. Directors, the government, SPMS, and the healthcare professionals who are the drivers of this process together with the patients. They need to have this leadership capability and know what technology can offer us. How can we change inside our organization so that we can reach new ways of providing healthcare? And this issue also requires skills, digital skills for everyone. And these responses, training in the field of digital, is something we need to work on so that they may exist. Academia, SPMS, the institutions themselves train, give their healthcare professionals skills that will be essential in the future. I mean, it's already essential in the present for us to be able to achieve a common strategy for this whole area. João, Rodrigues, healthcare professionals, do they have a determining role here? Obviously. Dr. Raquel has already spoken about it. Before the pandemic, there were some measures that were already being implemented because we need to have the capacity to attract and maintain qualified human resources in our NHS. And the pandemic showed this. It showed us the vulnerabilities and the need to reinforce them and create the conditions to remain in place. That is complex. We have stagnated careers. They have been like so for the last 2 decades. We need to revitalize them to offer better conditions. And the pandemic showed the professionals like the NHS, but they need to have these goals. And associated with this, and I think it's important to mention it, we need to have healthy healthcare units that have the conditions to take care of their professionals too. But professionals have already become adapted to technologies. Generally, we've been pointing towards the need of developing. It's not, when I talk about a single medical record, it doesn't have to be single. I mean, technology is diversified. There should be competition between companies and whatnot. But me, as a citizen, I need to have access to my information. I need to make sure that it is accessible to all healthcare professionals. I don't need for it to be repeated and doubled. If I have a record in a hospital, it needs to be made available to my general practitioner, no matter where I am. If I have a record in continued care, the doctor needs to have access to it, etc., etc. This is one of the areas that we need to evolve towards. I'll give you an everyday example. It makes absolutely no sense with the technology we have today. Okay, I'm a general practitioner. I need an opinion by someone who deals in pneumology, for example, Raquel in Vila, Gaia. I need to send her the information in a different program. No, what I should do is send her a flag for her ward, whatever. She checks those red flags and goes into my patient's medical record. And the question, the doubt, the query will be there, and she can respond it. We need electronic referrals, and we need people to get talking to one another. We've already taken massive steps in Portugal. We're not really that bad, but we need to complete the building. Medication, for example, is accessible to everyone. All doctors, regardless of our specialty, we can view a prescription by any doctor. That's a step, but we need to do it in every other area. I would just like to quickly refer to two very simple areas that the pandemic showed us. We need to invest in monitoring those who are most vulnerable, including the elderly. This is an area that the pandemic showed us. Nursing homes, for instance, there needs to be an integration of care. We need to reinforce this network. We cannot separate it from the reality. Social Security needs to have a strategy in line with health, with local government, with the municipalities, and we need to have the capacity because, once again, it's where is this common file for that population? We have vulnerable patients, and that is one of the areas that arose, this need to better integrate care, including care that don't have to do with health. They have to do with the municipalities, the charities, Social Security, but they belong to all of us, really. To conclude, or to bring all of this home, we have a lot to do to integrate care on several levels. Normally, we have a tendency to compartmentalize the care. We put things in different drawers, different compartments, and this pandemic showed us that we need to integrate everything. We need to have multidisciplinary teams. We need to discuss what is being done for that patient, and this needs to be done inside the hospital, inside the healthcare unit. And we need the capacity to integrate all of this. So because the patient is still the same, he won't double or triple according to the unit. And this is fundamental. There's still a lot to be done. We need to qualify and generalize it. Raquel, Duarte. We've been talking about empowering and capacity building in professionals and centralizing patients. Will we be leaving anyone behind? Is there a mission here of including a fringe of the population that feels more excluded in this digital age? Yes, if we make that mistake, which is ignoring that we have this fringe. I would just like to pick up on what Dr. João said. A lot has happened recently. Today, I can have a consultation anywhere. And I can see what happened, for example, what was the opinion given by the general practitioner, the orthopedics. I can see the tests and blood work that was done. I can see the blood work. I can do the tests. I can see the prescription and see what medication the patient is on. So, although it is not perfect and it has some vulnerabilities, we are starting to walk in the right direction. We can increasingly make it easier to have access to information on the patient's health. And that is good for the patients. I started working many years ago. I have gray hair. It's due to age. And I recall patients having to carry their CAT scans, their x-rays, and now, no. Anywhere, I turn on my computer and I have access to all the tests. When we speak about telemedicine, remote medicine, these platforms, access to electronic prescriptions and diagnoses, means for diagnosis, we need to develop strategies according to the convenience, efficacy, and safety for both the carer and the patient. And we cannot forget the patient or the user. We have people who, because of the lack of mobility, because of their education, they cannot access platforms that will lead them to remote consultations. I had patients where I tried to have consultation, infectious diseases, for instance, and some patients couldn't connect to the platform. So we need to be aware that these fringes exist, and it is our duty to make sure that there are alternative responses available. That is our obligation. It is a threat, and I'm sure these are known. They need to be solved. We need to identify strategies for these people who find it difficult. Of course, Teresa Magalhães, there is this need to reach these people and have these strategies so that no one is left behind. Yes, as Dr. Raquel Duarte said, and Dr. João also. Those people may need different care. Here we need to understand how technology can help and where technology can hinder. It's the services who need to organize themselves in the future so that telemedicine or remote medicine is a strategy for working within the institution and not last resort because it is needed. And I think that here is where the main challenge will lie in the future, how organizations will respond to this challenge. Of course, João Rodrigues, post-pandemic, there is another important word for non-COVID patients. What should we tell them? Let me just go back because I remembered something with regard to the previous question. The Ministry of Health, at that level, and thinking about those who are excluded, started with the Northern Authority, and now it's in the center, and it will have a NHS 24 desk, an electronic desk for proximity with an intermediary who is a local agent from the municipality who has been qualified by the Ministry of Health to be able to have access to sensitive information. As we know, it's health care information, it's sensitive. And with the patient's permission, there will be a proximity intermediary to do what they won't do because they're digitally excluded, whether it's a certificate, a prescription, an appointment, to schedule an appointment. So, as Raquel Duarte said, it is possible as long as we are attentive to this because our population isn't all the same. And we need to involve our communities, our municipalities, our parishes, and obviously anything that has to do with organizations and charities and so on, they need to have the technology too. What should we tell non-COVID patients? Well, this is one of the areas that showed that we didn't have the resources for everything, and we had to act on what was pressing, which was the severity of the pandemic. This means that we're already recovering in several areas, but we need to review everything that we didn't do, and it's being reviewed, and program it in order to recover a lot of the non-COVID activity that was left behind. Namely, and this has been the concern, namely with the more vulnerable. We're talking people with chronic diseases. Some of them have 2, 3, 4 comorbidities, diabetes, high blood pressure, osteoporosis, bronchitis, obesity. All of these are associated, and these are the patients who were left at home. And to conclude, one of the areas where we learned is that we need to improve home care in health. So the transport network is crucial, and it needs to be adapted to the local reality. We have areas of the country where we need mobile consultations. We already applied for it to be funded and to have that network where we need it. The healthcare goes to the proximity. It's not a question of extension. It's a question of having a mobile practice with the prescriptions, with medicine. And at the same time, we need more cars, more accessible cars with, for example, we saw with vaccination, Gulbenkian had an agreement with all of the health authorities and provided cars with a driver for vaccines at home. And that is an example we need to maintain. It's not just about COVID. It needs to be for flu, for home care, and all the other dependencies.
Thank you, João Rodrigues. I will pass the word to Raquel, professor of medical school, and I would ask you, a year later, what are the lessons learned that you can add to what you teach and share with your students? First, we had a public emergency in health terms, and to give answer to this and to the others that will come, we need to have strategies. And strategies that need to be focused in 5 points, and I think are crucial. We need to be fast. We need to be flexible. We need to be near people. We need to bear in mind the vulnerable populations and what they need. Fastness. What we understood of this pandemic is that the countries with better results were the ones that gave fast answers to be close to endangered populations, to have easy, understandable answers, to have the people capable of understanding the danger and to lead with it, to be more adherent to the recommendations coming from the entities. So flexibility, we need to find strategies that are flexible to give answers to the needs. We were able to increase internment, but we didn't have the human resources. The best measures were the ones flexible enough to be provided. With the transformations of infirmaries to working in network, the communication with the human resources. I'm not just talking about Portugal. I'm talking about emergent situations. Portugal inclusive, we need to invest more in our professionals, our health professionals, and proximity as well. Dr. João spoke about the primary healthcare, and we need to continue this in remote medicine as well. I love the remote medicine concept, and once again, we need to have mobility to ensure that the patient is well taken care of, whether it's at home or not. We need to give answers and alleviate situations like this in the hospitals. Dr. João spoke about the elderly. We have to ensure that they are taken care of. It's very important to focus in the social aspects, the economic aspects. We need to have universal return. It was crucial, and it was a key piece of success in the answer given. But we can't forget and identify and give answer to the reasons, the direct reasons why those people that have excess risk because of their social economic issues, why that excessive risk exists, and to bring measures that can solve it. Approaching these economic social determinants that needs to be done, and it will demand investment in prevention. It will demand intervention that overcomes, it's beyond the healthcare system, includes social security, but not just social security. It demands that people have to have good conditions at home, in their work environments. In reality, it's multidisciplinary that goes beyond the health issue. And cooperation. It's crucial as well. Resilience, capability of giving answers in health terms is a challenge that, once again, multidimensional. It needs integration, not just national, regional, and also international. Sharing information, sharing professionals, health care professionals. The vaccination is a bad example. We know that it's being centralized in a few countries. If the world itself is not vaccinated, we will still have pandemics. So it is crucial to it is a key tool for the success in the answer to be given in this and other issues to come. Thank you once again to the three of you for sharing your knowledge and these clues you leave us of what is crucial for the future to be in post-pandemic. To thank you all. See you soon.